I remember the doctor saying to me, he said, I have nothing good to tell you, because he just knew that that we were really looking for the positive. But in this was just, his bone marrow was failing.
Being a bone marrow recipient is the last resort. And so that was a hard message.
Yeah. And I don't think we even knew that much about bone marrow transplants. We just knew that they were something very serious.
Yeah.
And that's he said that would be the only answer for a possible cure for him, and that without treatment, he wouldn't survive more than 2 more years.
30 years ago, we often talked about death and dying with dignity. We don't face cancer that way anymore. We start to talk about survivorship. We're still using a hammer to treat this disease. The treatments that we have today are exactly that. They're very powerful. They've fortunately been very successful, but they have a lot of repercussions. They will kill the cancer cells, but they're going to affect the entire child, the entire organism. So that child is going to have long-term health effects that are unique based on the therapies that they had.
We saw plenty of children who, some children who they died, not from their disease, that there's a cure for their disease, but from one of the, long-term side effects.
Or even the treatment itself.
Or even the treatment, yeah.
And so there's still, even though it's gotten so much better in the last 30 years, there's still that need to continue to refine it and make it better, because some of the kids, their blood showed that there was no trace of cancer, but they couldn't survive the treatment. There's really only one issue that we're monitoring with him, and that's he has really bad cataracts from the steroids that he had to take, and at some point he'll have lens transplants in his eyes, but other than that, he's just a healthy 7-year-old.
Yeah.
But now we're starting to see that the risk of dying is actually starting to become from long-term effects rather than that risk of the primary disease. So it's important for us to understand what those long-term effects are. Can we screen for those early? And then we need to understand and we need to develop studies to prevent them.
I think it's just in the last several years they've started up the, which CCRF has been a part of, is starting up the follow-up clinic for blood and marrow transplant patients. So just to know that it's not just about getting the treatment done, but refining it and continually looking at it and seeing how they can make it as least invasive as possible to give a better quality of life afterwards.
It's a circle, and we're seeing this come full circle. We wouldn't have a long-term follow-up clinic if we didn't have the science that Children's Cancer Research Fund has funded here in the Cancer Center. We've been able to bring those treatments directly out of the laboratory here to the bedside. We've realized the benefit in our long-term survivors. We need to understand what the effects of those treatments are on those children, and so we can maybe better wrap this around and develop better treatments up front for children that are diagnosed tomorrow.
And that's the thing, that advances that are made here in research, they then go out to everywhere, so that, it doesn't matter if you live on the East Coast or the West Coast, that the work that's done here will reach out and benefit everybody.